Welcome to the Healthcare Motivation Channel, your dedicated space for inspiration, support, and practical wisdom tailored for every healthcare professional and caregiver. If you find value here, please click like and subscribe so you never miss an uplifting message. And remember to share this video with a colleague or caregiver who could use an encouraging word today. Together, we can lift each other up and strengthen our healthcare community. Today's topic is staying positive in a high-pressure environment. Hello, my fellow healthcare heroes. Many of you work in healthcare environments where the stakes are high, the pace is fast, and the emotional toll is real. Yet, you persist. The question is, how do we not just survive, but thrive in these high-pressure settings? Let's turn to the science of positive psychology, pioneered by Dr. Martin Seligman. Dr. Seligman's research reveals that well-being is not just the absence of distress, but the active cultivation of PERMA, which is the acronym for positive emotions, engagement, relationships, meaning, and accomplishment. Dr. Seligman's PERMA model is a framework that isn't just theoretical, but rather it is a roadmap for flourishing, even in the most demanding environments. Today, we will share 3 actionable strategies, each rooted in high-impact, peer-reviewed research that demonstrates why positivity is not a luxury, but rather a necessity for healthcare professionals and caregivers who provide healthcare for their loved ones. The science. Why positivity matters in healthcare. Positive psychology interventions, or PPIs, have been shown to significantly reduce symptoms of depression, anxiety, burnout, and stress among healthcare workers, while increasing job satisfaction, resilience, and subjective well-being. Positive psychology interventions, or PPIs, have been shown to reduce burnout, anxiety, and depression in healthcare workers by up to 30%, while simultaneously increasing job satisfaction. Mindfulness and gratitude, commonly used in healthcare settings, have been linked to improvements in well-being, job engagement, and reductions in burnout. A systematic review found that well-being interventions led to improvements in quality of life for healthcare workers, with reductions in perceived stress, anxiety, and depression. Physical benefits have also been documented. PPIs can lower inflammatory biomarkers and cortisol levels, supporting not just mental, but also physical health. Let's break this down into practical, evidence-based strategies you can use every day. Tip number 1. Start shifts with positive affirmations. The way you begin your day can set the tone for everything that follows. Positive affirmations can be simple, intentional statements of self-encouragement. Positive affirmations are more than just feel-good mantras. Research shows that positive self-talk can activate reward centers in the brain, reduce stress hormones, and foster resilience. For example, Dr. Seligman's 3 Good Things exercise has been linked to increased happiness and decreased depressive symptoms, with effects lasting up to 6 months. Actionable practice. Before your shift, take 1 minute to state 3 positive affirmations about yourself or your work. For example, I am prepared for whatever today brings. My skills make a difference in someone's life. I am strong and I can handle today's challenges. Why it works. This small ritual primes your brain for optimism, counteracting the negativity bias that makes us dwell on problems and setbacks. Over time, these positive affirmations can build a foundation of psychological strength essential for navigating high-pressure environments. Tip number 2, focus on what you can control. Healthcare is filled with unpredictability. Patient outcomes, system constraints, and resource shortages are often beyond your control. Dr. Seligman's research on learned optimism underscores the importance of focusing on factors within your control. This approach not only reduces feelings of helplessness, but also enhances your sense of well-being. Actionable practice. When faced with a stressful situation, pause and ask yourself, what is within my control right now? What small action can I take to improve this moment? For example, you may not be able to change a patient's diagnosis. However, you can control the compassion you show. You can control the clarity of your communication. You can control the support you offer a colleague. Studies show that employees who perceive greater autonomy and control over their work experience less stress and higher job satisfaction. In fact, the Harvard study of adult development found that autonomy at work is a key driver of well-being and resilience. Employees who feel they have autonomy and control over their work report 40% higher job satisfaction and significantly lower rates of burnout and turnover. Tip number 3, share uplifting stories with your team. Positive relationships are a cornerstone of the PERMA model. In high-pressure healthcare settings, sharing uplifting stories such as patient recovery, teamwork, or gratitude can be a powerful antidote to caregiver burnout. These shared narratives foster connection, reinforce meaning, and remind us why we chose this path. Make it a habit to share one positive story or share a win during team huddles or shift handovers. Encourage your colleagues to do the same. Team engagement works. Research shows that teams who regularly share positive feedback and success stories experience higher engagement, trust, and collective strength. For example, Healthcare workers who participate in gratitude-based interventions report a 23% increase in overall well-being and a 19% decrease in depressive symptoms, with benefits lasting for months after the intervention. In addition, mindfulness-based interventions have led to a 25% reduction in perceived stress and a 20% improvement in quality of life among healthcare professionals. Bottom line, strong work relationships are not just nice to have. They are the single most powerful predictor of happiness and engagement at work. It is important to challenge assumptions beyond just staying positive. Let me be clear. Positivity is not about ignoring stress, pain, or systemic challenges. It's about cultivating authentic optimism grounded in self-awareness, connection, and evidence-based strategies. Dr. Seligman's research shows that positive emotions broaden our thinking, build resilience, and help us recover from adversity. It is important to know that you are more than the sum of your tasks. You are the heart of healthcare. By integrating positive psychology practices into your daily routine, you are not only protecting your own well-being, but also uplifting your colleagues and patients. Remember to start your shift with intentional affirmations. Focus on what you can control. Share stories that inspire. Stay positive. Stay strong. And remember, you are never alone on this healthcare mission. Thank you for joining us on the Healthcare Motivation Channel. If today's message inspired you, don't forget to click like, subscribe, and share this video with a fellow colleague or caregiver. Your encouragement could be the boost that someone needs to feel supported and to keep going strong in their mission to care for others. Stay motivated, stay connected, and we'll see you in the next video.